Hello everyone. This is going to be my last video in my breast series for the month of October. So if you've missed the last two, I'm gonna link them down below so you can go and catch up on them. I really wanted to end this month with a self breast exam and how to do it. We're told all the time, especially as women, that this is something we need to be doing regularly, but I know that no matter how many times I do it, I've always had questions about it. I've always been like, am I doing this right? Is it supposed to be feeling like this? What exactly am I looking for again? My intention for this video is to demystify the entire experience and to also make it a less scary experience. With all of that being said, obviously I am not an expert in self-exams. So today I'm bringing in an expert. I'm going to be joined by Jennifer, who is a provider at One Medical. Typically when you go in for a wellness exam or you have questions about your breast health, someone like Jennifer is going to be your first point of contact in that experience. Most of us will see someone like her first before going to any kind of specialist, if that's what we end up needing. Jennifer is going to walk me and all of us through the self-exam process, and then I'm gonna ask her some questions that I feel like we all have on our minds, but sometimes we're a little afraid to ask. All right, so I am here with Jennifer now. Thank you so much for being here.
Thank you for having me.
Why don't you tell everyone a little bit about what you do?
So I am a physician assistant at One Medical, which is a focus on primary care. So I help take care of patients in all areas of their health, and I also have a focus on women's health.
How often do you help women with self-breast exams?
Every day.
Oh my gosh. Okay, so you know what you're talking about.
Yes, definitely. This is a conversation that I have multiple times a day.
We're gonna jump right into a demonstration, and there are a few different ways that you can do a self-exam. So what is the first way?
So the very first way, you're actually gonna start by inspecting your breasts.
Okay.
And so we wanna do that standing up in front of a mirror.
All right, so we're standing now. Normally you wouldn't be clothed, right?
Yep, no clothes, no bra either. You need to actually be able to visualize your breasts.
Obviously we can't do that on YouTube, so I'm wearing a t-shirt today. So what is the first thing that I should be doing?
So step one is you're gonna be facing forward and put your hands on your hips.
Okay.
And you're really just gonna be inspecting your breasts. So one breast is always gonna be a little bit bigger than the other breast. That's completely normal. So that's not a red flag at all. So inspecting your breasts and kind of get comfortable. Which breast is bigger than the other? That's something you should kind of know.
I definitely know which one is bigger than the other.
That's already an important step. It really is. And what you really want to be looking for is any changes in the skin in particular. There's something called dimpling, which is exactly the same as the dimples in your cheek, where you have little areas that are kind of poking inward. That's something we would want to investigate further. You also want to look and see, are there any actual visible lumps that you can see that look asymmetric? You also want to inspect the actual nipple. Does your nipple point inward or outward or left or right? These are all normal changes, but again, we really just want to be comfortable with what our breasts look like.
Checking yourself out,
Exactly.
basically.
The next step is you're going to actually put your hands behind your head, and this just raises the breast tissue up a little bit more so that you can get a better look sort of at the underside part. And same thing, no touching yet, no examining, we're just looking. The next step is we're actually going to be lying down. Step one, depending on which side you want to start on, doesn't matter, whatever you feel comfortable with. You're going to lie with a pillow behind that side, so right behind your shoulder. We'll start on the right, and you put your right arm behind your head. Then you're going to be using your left hand in order to examine the right breast. What I do is think of it as a clock. So you want to start on the outside of the breast, and you're doing little circles while you go in a big circle. And you're starting with light, superficial pressure. So exactly like Ingrid's doing. She's doing little circles as she moves in a big circle. And then think of a pinwheel. Once she reaches her starting point, you move slightly inward toward the nipple and do another circle around. So you have a clock and a pinwheel. Continue doing these little circles in bigger circles until you reach the nipple.
I've never been taught this way, so this is all new for me.
And then once you get to the nipple, it feels a little bit awkward sometimes, but you want to give a little tiny squeeze to the nipple. And this is checking for any discharge or any blood that might be coming out of the nipple, which can be a sign of something else going on. And then you're going to do the same exact thing with a little bit firmer pressure. So you're going a little bit deeper, but you're repeating the same going in a clock in a pinwheel, just a little bit deeper. And the final step is actually moving up a little bit into the armpit. So the breast tissue extends a little bit into the armpit, our side boob, if you will. Yeah. And that's also an area where masses and lumps can be found, so you never want to ignore that.
The last way to examine yourself is in the shower.
When you're doing it just on your dry skin, you kind of have to keep picking up and moving around. And in the shower, you can glide a little bit more, which can help you appreciate different masses or textures that you didn't notice lying down.
What exactly are you looking for, too? Because I feel like that is always my question, no matter how many times I've done it. I'm like, what am I looking for again?
Definitely.
What exactly?
Totally. And this is what I hear from patients all of the time. What am I looking for? It's less important to focus on exactly what you're looking for, because even with training, sometimes I can't tell by just touching someone what's maybe a benign thing and what's a worrisome thing. But what's most important is body awareness and just really being comfortable with your own breasts, because then if something is new or changing or different, that's when you're going to want to have it peeked at. And I'll often tell patients after their physical or after their pap smear, after I do a breast exam on them, I'll say, okay, everything feels perfect today, so go home and memorize what your breasts feel like so you know this is exactly how they should feel. And then if something doesn't feel like it does today, then you come back in and we'll take a peek. And even with training, it's hard for us to differentiate sometimes between what's something worrisome and what is not worrisome. So you can focus a little bit less on trying to detect or find a worrisome lump and just being more, again, aware of what your breast tissue feels like. Breasts have lots of lumps and bumps to them, and 99% of that is very normal. But a general rule of thumb is any type of lump or bump that's firm, that isn't moving around too much and feels disconnected from the rest of the breast tissue would be something you would want to have checked out.
Are there certain times of the month throughout your cycle that it might feel different too? Because I am about to start my period and my breasts are really sensitive and they definitely feel different from other weeks.
Yeah, absolutely. Hormones play a big role in our breast tissue changes. So the best time to do it is the week after your period. That's when the hormones have kind of run their course and normalized a little bit more, and it's more going to closely resemble your baseline breast tissue.
So who should be giving themselves a breast exam, and are there people who need to be doing it more often than others?
That's a great question. So what we say sometimes is anyone with breasts should be giving themselves a breast exam. So this, of course, includes women. Typically, we say starting sometime after puberty, maybe young adulthood. This also includes a small subset of men who are at higher risk for breast cancer. Male breast cancer is pretty rare. It's less than 1% of breast cancers, but it shouldn't be forgotten. And then we also want to think about both transgender men and transgender women. People who should be doing it more often, it's not necessarily doing it more often, but it's perhaps doing it with a higher priority. So everyone should be doing them to a certain extent, but certain people who are higher risk, so those with a family history, especially if there's a BRCA mutation, are those who should be not forgetting their monthly exam. The average risk woman, it might be okay if you forget every once in a while, but a higher risk patient should really be more mindful of making sure they're definitely getting it in at least once a month.
And what age should you start a self-exam?
It doesn't need to be any earlier than pre-puberty, than right around puberty. So once your breast tissue has pretty much finished developing and going where it's going to go, is a good time to, again, start getting familiar and comfortable with your breasts. You're very unlikely to find any problems at a younger age, teenage and young adult, but again, it's a great time to just get in the habit and get comfortable and familiar with your breast tissue.
Totally. I started when I was a teenager, and it was just so awkward for me to be spending time with that body, especially because I had my own issues with my breasts and I just wasn't happy with them. But as the years have passed, I've really become a lot more comfortable with just seeing how they are. I've had 2 points in my life where I've found lumps. Once when I was a teenager and I was pretty new to examining myself, and then another time just a few years ago, and both times were really scary. What do you recommend to patients when they do find something?
So the first thing to recommend is don't freak out. I know that's easier said than done, especially in this day and age, because first step is you're going to feel something. Second step is you're going to start Googling to find out what it is that you're feeling. Don't do that.
Yeah.
So the best thing to do when you feel something, try to remain calm and remind yourself that the vast majority of things that you're going to feel are benign. Breast cancer is, even though we hear more and more about it, it still remains a fairly, less common diagnosis in young, healthy people. So don't freak out, but definitely call your healthcare provider. Your primary care provider is the best person to give an exam to you as well, and then direct you in the next steps.
Both times when I had screenings, they were benign. So what are those lumps that they're finding? Why do those even appear in the body?
Yeah, so our breasts have lots of benign lumps. And the most common things that we find are cysts, which are just fluid-filled little collections in the breast tissue. Things called fibroadenomas, which are also benign little tumors. The word tumor does not mean cancer. It's just can be a benign little mass.
So the main things really are getting to know your breasts more and becoming comfortable with your body, doing it as regularly as you can, so setting reminders. And if you do find something, trying not to let your imagination run wild, and go to your healthcare provider and ask them questions from there.
Yep, absolutely.
Well, thank you so much for being here, Jennifer. I feel like I learned so much.
Good. Thank you for having me.
Yeah, I am definitely going to be setting a reminder for myself and adopting these practices into my routine.
Great.
Thank you so much.
You're welcome.
That is going to be it for my video today, and I have to say that this is a video where I just learned so much throughout the process. I think we as women especially can be really uncomfortable with the natural functions of our bodies, the way that our bodies look, the way that they feel, the way that they smell. And the more that we get in touch with how we are, the more that we will notice when something changes. And that is the ultimate service that we can do for ourselves. Self-care is something that is getting more and more attention, but a lot of the time we are seeing self-care as face masks and spa days. But personally, I think that learning how to do a self-exam and learning how to connect with your body over time to be able to pay attention to the changes that are happening within your body, on the outside of your body, that is the ultimate form of self-care, because you are connected to yourself. So this weekend, I am going to be making my self-care Sunday into a self-exam Sunday. If you decide to take part in this, please post a selfie after you do your exam, obviously with clothes on. Not looking for any kind of those photos, just saying. Make sure you tag me in your post and also use the hashtag self-exam Sunday so I can find your posts and share them in my Instagram stories. I want to end this video by saying that I am so grateful for Jennifer and people like Jennifer who have dedicated their professional lives to improving women's wellness. They are empowering us with information that make our lives more vibrant. You can just tell that I'm invigorated by just having this knowledge that I didn't have before we shot this video, and I'm so grateful for that.